Good morning, everybody. Hey, it is Coffee Pan Dulce, and it is Wednesday, September 29th, the last Wednesday of the month. And there's the music. Yeah, we're a little slow this morning. We're on Texas time, so it's 9 o'clock there.
Right.
But anyway, good morning, everybody. Good morning, Christian. Good morning, Dr. B.
Good morning. Good morning, my friends from Charlotte, North Carolina, and Colorado, and St. Bernie is in front of the on-air. I don't know if you can see him. You can see his silhouette. So he is there. So good morning, everyone. Welcome to Coffee Pan Dulce. I'm Christian Cano, one of your co-hosts, along with Jenny-Jaymes Gunn, Mama Ruth, Stephen DeFiore, and Barb Bacon. I think it's just Jenny and I, along with Dr. B. So great to have you back, Dr. B. You're still in Colorado. Wow.
Correct. Yep.
Must be nice.
By and large, right.
Yeah. Well, listen, we have a great show today. It is the last, September's over, almost, right? If you are in Texas, anyone who knows Texas, the State Fair of Texas is actually on. So if you're into fried cheese, fried chocolate, fried everything, it's, you know,
and COVID super spreaders.
That's correct. Yeah, COVID super spreaders. You know, we were talking before the show about some situations here in Texas, but also I always wanted to know if the State Fair of Texas was ever sponsored by Lipitor. I don't know if anyone gets that.
Yes.
Okay. All right. Good. Because, you know, that would be like, here's your fried cheese and here's a Lipitor sample pack. Here's your fried cheese and here's
complimentary. Yeah,
that's right.
You know, and not to get into conspiracy theories, but you think that
please don't.
These pharmaceutical companies and stuff were sponsoring all these fairs because they're like, I mean, fair food is stuff that you typically wouldn't eat, but you go out and you get a turkey leg and funnel cakes and you know and sugary treats and I mean, I think that's why people get sick on the rides. I think they destroy themselves with food that you wouldn't eat.
It's not actually the ride, it's the
and then I think it's a good idea to go ahead and spin you about 1 million times and tilt the worlds and stuff. I'm thinking, what a great combination. Somebody was definitely a very sadistic person when they came up with the concept of the American fair.
That's
like,
right. That's
you
right.
know, I mean, when you think about it, I mean, it's kind of funny.
Yeah. Well,
I think after 11 months by yourself on a farm in Iowa raising corn, anything goes, right?
Hey, that's the only time you can meet. Yeah. That's the only time you can meet your future spouse, I guess. That's how maybe that's the way they were set up that way. I don't know. Well, okay. So let's go ahead and salute to Coffee Pan Dulce before we go around the Brady Bunch screen, whatever you're drinking. I am drinking oat milk still. So I'm still very excited to be drinking oat milk. I was craving whole milk the other day, but that's just a crave, like a cigarette smoker. And also traveling all the way once again still from Charlotte, North Carolina. We want to thank our producer, sponsor, and supplier, Manolo's Bakery, who is on Central Avenue in Charlotte, North Carolina. Please support your Black and brown small businesses or any small business during this global pandemic. But Manolo's Bakery, of course, wonderful bakery. I have to say I cheated on Manolo. I've eaten Mexican food quite a few days here, and one of them had this great bakery, and I had to buy some pan dulce here. Yes, I bought all kinds of stuff, and actually they're little pigs, the ones that we talked to Barbara about. They taste different here than they do in Manolo's. I think they put more ginger in them here. I don't know. Anyway, I need to share that recipe with Manolo so that way he knows. Okay, so with that said, yeah, I'm thank goodness you're running the show today, Jenny, because I can tell it's a talkative day for me. So let us go around the Brady Bunch screen, and Dr. B and Jenny, if you can just talk a little bit longer today so I can share us on social media. Who wants to go? Let's Jenny and then Dr. B. Do you mind?
Sure.
Okay.
Sure. We'll go to good morning, everybody. Hi, I'm Jenny-Jaymes Gunn, an LGBT community advocate. I'm involved with several organizations, including Charlotte Pride, the LGBT chamber, or the Carolina's LGBT chamber, I believe is how you're supposed to pronounce it. They've changed it up because we now cover more than just the greater Charlotte area for the LGBT community. And then also the National Organization for Women, the Charlotte chapter. In fact, we have I'll talk about later at the end of the show, but we do have a women's march to stand in solidarity for the women and people with ovaries in Texas that have endured a horrific very bigoted, anti human being bill. I mean, there's no other way of saying it. And I think anybody that doesn't have ovaries shouldn't be making laws about people with ovaries, and it's just kind of archaic and barbaric, and definitely aimed towards specific communities. So always fun, but that'll be this Saturday morning. We will have that here locally here in Charlotte. Started by the local Women's March Committee and several other organizations. Dr. B?
Great. My primary advocacy is Medicare for All. I can't find my button this morning. Associated with that is Black Lives Matter and anti-racism. And out here in Western Colorado, a fairly rural community, not too far from Aspen, I'm supporting Western style because the cattle drive usually comes by every year right in front of our condo. And it's kind of an exciting little thing coming through town twice a year. So that's my thing.
Excellent. Well, I'm curious if anyone knows any history from Fort Worth, or I'm actually technically not Fort Worth, Texas, but I'm in, the Fort Worth area here. The Chisholm Trail. I wonder if that goes all the way to where you were, Dr. B.
There are a bunch of trails. The Chisholm, the Santa Fe, the Oregon, all these different trails during the westward expansion. And I don't know the routes on them.
Excellent. Well, I'm Christian Connell, once again, one of your co-hosts, and my buttons are Medicare for All or Healthcare for All, as Barbara likes to tell us. Moms Demand Action, gun sense legislation. I'm completely for that. I'm not a gun owner, but I support gun owners as well. And then Trust Women, of course, as Jenny said, please trust women. I agree. Men shouldn't be sharing what's best for women's reproductive rights. And then, of course, Joe Oldham, who's a friend of ours and a guest of ours who passed away at a very young age in Charlotte, North Carolina. So with that said, let's quickly talk about the 3 current events, and then we'll go directly into our topic. Today's topic is Medicare Advantage a scam? We're ready to get into this. A year ago, almost around this time period, we actually did a show called What is Medicare Advantage? Because we wanted to educate people, because open enrollment is going in now, and I think until December, or it should start and then goes into December. So the 3 topics. Our federal government is in the process of trying to decide if they're going to shut down the government or reconciliation. There's all kinds of, I want to use Jenny's words, hijinks and buffoon. What is it? What do you say, Jen? What is the term you use? Yes.
Shenanigans. Well, hijinks, shenanigans, and fuckery.
Fuckery, that's right. So, and I Googled fuckery. It's actually a word.
Yes, it is.
It up.
No, it's really a word.
Okay.
It's in some of my favorite movies too.
Oh, okay. All right. So it's like in sports, they have a word called physical kiliality. That's not a word. I should look it up. Okay. Also, there's a young, the news media has been all over that since I was driving here. There's news media about a young white girl who was missing and then now has been found dead. I thought she was a celebrity. I want to see what you guys think about that, because I was like, who is this? And it was this, everyone is just, glued to the TV with this person. I don't even know her name offhand. And then also, I don't know if you want to talk about some of the healthcare big hospitals like Novant Health, and then also one in Houston, Texas. They have laid off a bunch of people or fired a bunch of people who didn't get vaccinated or are not going to be tested. So real quickly, who wants to comment on any of those?
Well, I guess I'll go first again.
Go
First, I'm gonna start with the fools that are getting fired, laid off, whatever you want to call it, because they won't do the right thing. Especially if you work in the healthcare industry, you really need to find a new career. Honestly, if you go into healthcare and you're not willing to do the right thing by people and by your clients, adios, see ya, happy trails, enjoy a new career, preferably around no people. The second thing is the debt ceiling. Once again, Republicans don't care about people. They don't care about our military and making sure they get paychecks in October. They don't care about senior citizens. They don't care about anybody. They'd rather look performative and look like they're being financially responsible while forgetting that they spent $8 trillion on a war for profits.
Exactly.
And racked up in a tremendous amount of debt during the Trump time, including giving a $2 trillion tax cut to people that don't need it. And we have taxation on corporations lower than it's ever been, not recently, ever been. For people that just absolutely don't need it. They have more disposable income than 10 generations can spend. Just ridiculous. And the most thing is the overblown thing about the these 1 or 2 white girls that disappeared. I'm going, how many Native American indigenous women disappear every day, and they never even get a bleep in the deal. Same way with Black women, Latinas, the whole 9 yards. How many women of color, Asian women, look what the Asian community is going through right now with Asian hate. That kind of stuff happens every day in those communities. But some cute little white girl, I feel bad that she's a victim of obviously domestic violence. The boyfriend did it, or allegedly did it. But the thing is, if that was another indigenous or Black woman,
would have
same age,
news coverage,
cute's a button, wouldn't have gotten any. Wouldn't have gotten any. And let's say it like it is. We wouldn't even heard about it. And if it did, it would have been, well, we heard that drugs are involved, or crime was involved, or
exactly,
or as the white media goes, and they raise the eyebrows. Allegedly there was crack cocaine found in the van, and and I'm like, oh, good Lord, here we go again, the crack babies all over again. So and racism, white supremacy kicks in one more time. But that's exactly what this is.
Dr. B, you want to comment on any of those, or? Okay.
On this thing about the people in healthcare who are choosing to lose their jobs rather than get vaccinated. A couple of years ago, when I was struggling to understand why there's this big division, I read a bunch of books, and one of them is called Moral Tribes by a guy named Joshua Green. And he has this wonderful analogy about going back to Africa when tribes were forming and blah, 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 and how, they used to kind of get along and have little scuffles. And then there was some common ground that they had to divide. And so pretty soon it got rancorous. And so he makes that analogy as a way to kind of explain how we all have our tribes, we all have our identities. And oftentimes the tribe takes precedence over your common sense. And I think this is just a perfect example of that, where I would bet a lot of money that almost 100% of these healthcare workers who are preferring to lose their jobs probably voted for Trump. I mean, I just really expect that is their tribe. That is a conservative. What do you call it? The de fiore. What is he? Libertarian.
Libertarian.
This libertarian strength that blah blah blah, and that is a tribe, and that dominates their common sense about being safe for myself, my family, and the patients I'm going to care for, and by the way, keeping my job. So that's just another example of the degree of which that force and attraction of the tribe can overwhelm all other kind of considerations. So I'm not sure they're stupid. I think they're just dominated by their tribal kind of clarion call, So it's really unfortunate, but I think that's kind of the explanation for it.
Any other you want to comment on the reconciliation or the
well, I don't know much about how politics works. Nancy Pelosi says we're going to be fine. Just watch this unfold. I don't know. You feel like strangling Joe Manchin in this Christian cinema out in Arizona. But I'm sure they're principled people. They think they're doing the right thing. Oh, holy moly! No, it's. I'm just having to put my head in the sand and wait till kind of this gets resolved. I can't imagine we're going through this debt ceiling thing again. It just seems like lunacy.
Yeah. Well, just real quickly before, because I know Jenny's going to basically take over the show from here going forward about the topic we have here. But on the reconciliation showdown, I agreed. I watched last week's show yesterday again, and Jenny made an excellent point. This is how government works. there's negotiation back and forth, and we panic. Oh, it's government. That's how government works. And then of course maybe it does shut down, it doesn't shut down. That's traditionally. So if you're a news junkie, of a government junkie, you're paying attention to this. If you're not, you're going to complain regardless of whether the whatever passes. Oh, they tax me too much. You always think. So I just believe, do what you got to do, the people who are in Congress, and don't worry about the Republican backlash or Manchin. Either go around them, whatever you got to do, because your average or everyday people are used to this. And that's kind of what I think. The Novant Health thing, I'm really glad Novant took that stance. I don't know that all those positions were like nurses. Some of them may have been other positions. And so maybe the number has been, it seems like a lot, but it may have been parking attendants or maybe some part-time people, just like Mecklenburg County, who don't even come to work, but maybe a couple of months a year and just didn't have a chance to, or said, I'm not going to do this. So that number, I'm glad Novant did that. And then with the white young lady who was missing, this has been something that Black and brown families have been talking about as long as I've been alive. We know that whenever a little white girl is missing, Amber Alert is on a white baby's name. When a little white girl is missing, the whole city looks for them. When a Black and brown young person is missing, so the joke is in our family is to say, call 911 and tell them it's a little white girl. And I mean, I know that actually is a joke. And so I'm just interested to see that other people actually understand that. So anyway, I thought I'd throw that in there, but that's my take. Jen?
Well, the conservatives will only respond if she's not pregnant. Let's keep that in mind.
Or if she was pregnant, they'll say she wasn't married.
Yeah. She had to be doing something wrong. She was pregnant. She wasn't married.
Exactly.
Welcome to the 1820s. I sometimes wonder if I'm really in 2020 or they tricked me and they brought me back into time to the Puritan movement. And I'm going to get dunked in the tank here pretty soon.
Yeah. All right, so let's jump to
one of those people.
Let's jump to the topip. Today's topic is Medicare Advantage a scam. So we probably start, and Jenny, I'll let you start this. We probably should start by maybe explaining what the difference is. I don't know if Dr. B wants to do it or you, or who wants to do that.
I mean, I'm not an expert on this topic. Sure. I mean, Dr. B does a ton of advocacy and a lot of amazing work with a lot of other just fabulous people that I've had the opportunity to talk to, and I know Christians also talk to them as well. And for what I'm going to do the layperson in the nutshell explanation of Medicare Advantage. Is basically it looks like it's a private supplementary program trying to fill in the gaps of Medicare. It doesn't have real good reviews online. I will say that. I just, because I'm, not eligible for Medicare at this point in time. So, I've never really put any thought into it. Yeah, I got a little closer this month.
That's right. That's right.
Or hopefully we get Medicare for all, and then we're all eligible. But I noticed that, and we'll talk about this further, that Medicaid, for example, doesn't have a Medicaid Advantage, co-program because Medicaid's all-inclusive. And so one of the first questions I have, Dr. B, is one, why do we need something like Medicare Advantage? Why does it even exist? I mean, what's the point of it?
Yeah, well, let's cut to the chase. Everybody knows that when one of the Bushes, I can't remember which was in, they were trying to privatize Social Security, right? And there was this big thing about just kind of give all these old geezers like me a little voucher and let them go invest in the stock market. Well, how do you think that would have worked out when they all invested in things that tanked like Enron and stuff like that? So that's probably not a good idea. So Medicare Advantage is an idea that started 30, 40 years ago, something to try and experiment with privatizing Medicare. And so it was a plan that the private insurance, for-profit insurance companies came to the Medicare people in Congress and said, look, because we're so freaking smart and because capitalism is the best thing that since sliced bread, we need to apply free market capitalistic profit-making principles to Medicare, to healthcare. And we can do it. So give us the same dollar amount that you spend on the typical Medicare patient, and we will do two things. First of all, we will make money because we're going to be more efficient and we're not going to spend as much. Two, we'll give better health care. We're going to show better outcomes for our privatized Medicare Advantage people, and we're going to save money. And maybe we'll kind of split the difference so the government will save money. So that was the plan. But it didn't take very long to find out that neither of those things were happening. And so the end result now is that Medicare Advantage costs the government more. It's very complex, as you would expect these bean counting, private for-profit capitalist kind of insurance companies. They have all this jiggering of the system, and they get little bonus amounts if they enroll somebody who's older and sicker because, why? And they also do something that's probably going to turn out to be a little bit criminal. And that has to do with upcoding. So that if you're in Medicare Advantage and you go see the doctor because you have a cold like me, well, the doctor might say, in a regular Medicare, okay, do ABC and it's going to cost $85. But in Medicare Advantage, they say, well, we need to make sure you don't have cancer. We need to make sure you don't have AIDS. So they'll do all these things and put all these little extra qualifiers on the diagnosis that increases the level of severity. And therefore the government said, oh boy, you guys are really taking care of sick patients. Well, they're not. It's all chicanery and sleight of hand. And so they're fundamentally cheating the government and making tons of money. And so that's the bottom line about Medicare Advantage. Now, the hooker is that they operate by trying to get younger and healthier people in their network, right? They don't want a bunch of old sick people that they kind of have to pay for, heart transplants and cancer and stuff like that. So how do they do that? You all seen the advertisements on TV with Schwarzenegger and not Schwarzenegger, I'm sorry, Joe Namath and these other kind of people that do these ads for Medicare Advantage. And what do they talk about? A gym membership. Who's going to be interested in a gym membership? Somebody who's 65 and pretty healthy, or somebody who's 90 and can barely get around because their hips are so bad they're all kind of stove up. So they with that, this gym membership is nauseating. That has a value of about $50 a year, but they use that to lure people in. And I've read that only 10% of the Medicare Advantage people actually use the gym membership. But that's their big come on. And they say, we're not going to charge you a premium, it's free. But then the hooker is that if you get in and you develop an illness like cancer and the best cancer specialist for your thing is in 2 states away, they say, well, I'm sorry, he's not in network. So you can either pay for him yourself or you can use our doctor that maybe isn't as good or something like that. So they have these restricted networks. And then the third hooker is that if you get old and sick and you find out that you're really being screwed by Medicare Advantage, you say, well, I'm going to take my, marbles and I'm going to go back to original Medicare. You can do that. But then you're going to say, and I want to get one of those supplemental Medigap policies, which are private insurance kind of things. Sure. And when you get those when you're 65, if you're on death's door, they still are required to issue you one. It's required issue or something. Sure. Once you get past this certain age limit, 66 or something, they don't have to do it. And they can say, well, because you're old and creepy now, we're going to charge you this much higher kind of premium. We're going to kind of we're going to underwriting your rating and stuff like that. So there's these 3 or 4 enormous pitfalls. They're basically, screwing the government. They're screwing their enrollees. And if you decide to leave, it's kind of like The Godfather. Once you think you've gotten away, they drag you back in because you can't get a Medigap policy once you're older and sicker. So that's in a nutshell. It's a lot of information, but that's in a nutshell that I think Medicare Advantage is capitalism gone wrong. Unfortunately, it sounded like a great idea, but it just kind of hadn't worked.
Well, I think anytime especially with the neoconservatives like the Bushes and people like that they started pushing the idea in the 1990s about privatizing government services. And as we all know, that's just another way of defunding essential programs like Medicare, public schools,
Social Security,
prisons, things of that nature. It's always somebody that they know that pays them a lot of money to run for office typically is behind it. We'll come to find out later that, the 3GS, the largest prison and detention center in the world, is also donated to a campaign, and a lot of these industries are billion-dollar and trillion-dollar industries, and double dip. They get the government money and they get people's money, and it's like, it's great for them, but it's usually on the end user, especially people in or around the poverty line or on a fixed income, like in seniors typically don't get pay raises. It's a horrific situation. And it puts them in a situation that's not much different than somebody that say is 40 years old and trying to find a private policy for themselves, and gets us right back to where we are. Conservatives and Republicans talk all the time about death panels and things like that, but now we have private companies making those same decisions. Christian, I think you had a question.
Yeah, I had a question because, I've been joking about this with Barbara all year long, because I watch MeTV. I don't watch regular TV. I watch just, older shows, and it has been on an all-day loop, the commercials for Joe Namath and Jimmy J.J. Walker. And all year long, it will give you a gym membership, a hearing, a dental, hearing, and it can even give you $120 a month back to your Social Security check. Dynamite. So I've been joking about that, but I've been watching those commercials. It sounds like they're just proving the case that if we had Medicare for all, that's what they're offering. They're offering exactly what is in the bill, and it's a private insurance. Okay, yeah.
Yeah, but they're not. It's all a bait and switch. And I read just yesterday, almost every day with the things that I get newsletters, whatnot, there's something new, scurrilous about Medicare Advantage. And the thing about these dental, hearing, and vision benefits, they say, we're going to give you that. And so you say, great, I need a hearing aid. Well, we don't pay for hearing aids. Well, what do you pay for? Well, you can go to an audiologist, they will pay, 50% of the bill. And so the basic numbers were that of the dental, vision, and hearing, that the Medicare Advantage only paid around 20 or 30% of those bills. So I used to have dental insurance, just regular private dental insurance, because my teeth were falling out. And I found out that, good Lord, on a $2,000 crown or something, it paid like $600. It's like, and your premium was continue to rise. So this just isn't making sense. And so, like Jenny says, what makes sense is Medicare for all. Oh my God! In this budget reconciliation right now, they're parsing out: should we allow government to negotiate drug prices? So that has become this own battle. And should we allow dental, vision, and hearing? And should we have an out-of-pocket cap? And all these things are being fought fiercely. Whereas if you just say, should we have Medicare for all? That would solve all these things. There's one argument, and we would be there, and all of this would be behind us. There would be no more Medicare Advantage. No, it's extremely frustrating.
But don't you think with all these, I call them schemes and scams by the conservatives, by the deal, a lot of times I believe they create a wedge issue, a socialism versus capitalism. Oh no, China's building up their military, whatever the subject is, we can switch it from Ponzi scheme to Ponzi scheme. And at the end of the day, I believe they create these distraction arguments as a way to detract from what they're really doing when they got their hands in the cookie jar or the till. How you keep that people distracted, say like seniors, for example, if they got to spend all their time researching all these Medicare Advantage plans and all this, and it's super complicated, they're not going to worry about who created it. They're just trying to survive. And I think the rank and file voter,
that's a good point,
gets
Jenny.
so confused. It's kind of like Muhammad Ali's rope-a-dope, look at the birdie, and then I crack you with my left hand. I think our government continues to do that, especially the conservative people in our nature, whereas we'll end up here pretty soon having to fix this, because Republican schemes always end with a nice crash of the system, whatever it is. It always happens. And we always have to go in. The Democrats always, Biden basically is a janitor. He's going in and having to clean up all about 30 years, about 3 decades of Ponzi schemes ran by the Republicans. So he's doing the cleanup duty in these years. And at the end of the day,
yeah, Jenny, remember before the show, you said this term.
I was actually getting to it.
Oh, I'm sorry. Go ahead. Sorry.
It's okay. I used a term and I stole it from somebody else in the sales business, direct sales business, but we call it anyway money. We're going to spend this money anyway as a society. So I hope to think that we're not going to let anybody die on purpose. And so we spend all this money defending our country and doing all these things, and we're going to spend the money anyway. Why not come with the most clear-cut, most concise, most efficient versions of it? And this Medicare Advantage looks like it's expensive to everybody, except for the private companies that are making bank off this. So at the end of the day, we're going to end up doing another bailout of Medicare and probably these private insurance companies. And we're going to spend the money anyway. And it's, and in the end, the cleanup is always more expensive than the prevention. As you know, in the medical industry, if people ate right and ate more salads and good stuff and ate less pork rinds and
State fair.
Yeah. Well, we started the show, which was a state fair food.
Yeah.
We probably wouldn't have maybe as many, heart surgeries and things of that nature. But some of it I believe is human nature, and some of it is the rich and the powerful go, let's make as much money off this particular subject as we can until the system collapses. And we keep doing this.
So what you're saying, Jenny, if I'm hearing you right, you're saying, we're going to spend this money anyway. Why don't we just go ahead and spend it right with something like Medicare for all?
Yeah.
Because we're going to spend when people say, how can we afford it? Because that was kind of my question with the Jimmy Walker. I was looking at that. I was like, how can they afford all that? And then because that's the same question people ask about Medicare for all. So, yeah.
But the Dr. B's point is they don't afford it. So the private companies aren't paying out. They're looking for ways not to pay out. Is that correct?
Yeah.
I mean, more or less, if you don't send that person to this cancer specialist, that's maybe more expensive than the local one because they're better, or whatever, for whatever reason. Then what?
Two things. In all my presentations about Medicare for all, I keep getting this question about how we're going to pay for it, even though in the presentation I go over exactly how we're going to pay for it and about how it would cost less than what we're getting now. That's always one of the first questions you get from a conservative person in the audience. And so I've learned that people who, after it's been explained to them, people who still say, well, we can't afford it and taxes are going to go up, and that is basically a smokescreen for saying, look, I don't believe in this. I'm never going to. It's like the anti-abortion kind of people. There's no argument you can make that's going to persuade them. They are just resolute. So that's kind of a smokescreen for them being able to politely say, I just don't want it, and nothing you're going to say is going to convince me. On this thing about the Medicare Advantage and J.J. Walker talking about saving money, the fact that they will basically pay your Medicare premium means that they're getting that money and more from the government to do so. And it's very discouraging. I have a very good friend out here in Colorado. He's very intelligent. He's an affluent guy. He's on Medicare Advantage. And I said, why? And he said, wow, it saves me money and a gym membership. And so it's amazing how much, and it's just amazing how to intelligent people, these little trinkets can do. And think about it. Doctors for decades have been encouraged to prescribe certain medicines because the drug salesman will come to their office and give them golf balls and give them keychains and coffee mugs and this crap that basically is of no value, but it's a free present, it's a free thing, and it changes your whole way of thinking about the person who gives it to you, and you become more inclined to kind of do what they ask you to do. So it's just very discouraging. This is salesmanship 101. Jenny, you know more about this than any of us do. Just give somebody something free and they're yours. And that's exactly what all this Medicare Advantage come on is. They obviously don't mention the fact that you are in a restricted network, and you might really regret your decision down the line.
So, you know, Jenny, hey, I just want to just follow up on something real quickly, because if you're watching this and you're watching it later, you know, we average about 2,000 viewers a show now, unless it's something really, then it goes way up. So my understanding is the main difference between Medicare Advantage and Medicare is what we consider traditional Medicare. You get a certain age and you get this health insurance that's paid for by, managed by the government or paid for by the government, and then you have to get like supplements, like a gap type of insurance. Is that right?
You don't have to get that.
Okay.
The bottom line is it gets so confusing so fast.
Yeah, sure.
Because fundamentally, in the original traditional Medicare, there's Part A and Part B. One of them is hospital, the other one is outpatient, doctor visit, physical therapy, all that. I believe for the Part B, the government will approve an amount and they will pay 80% of that. So you're on the hook for 20%. If you don't want to expose yourself, like if you're going to have a heart transplant, that 20% could be hundreds of thousands of dollars. For most people, it's usually not much. So because of that peace of mind, people often get these private supplemental policies called Medigap, because it's to cover the little gap in that 20%. They're pretty expensive. And I got tired of paying it. I went to a dermatologist and got something taken off. And it turns out my Medigap paid the dermatologist like $6. It's like, why am I paying a premium of $250 a month? It goes up the older you get. For me, I dropped mine because fortunately I feel like I'm likely would be able to afford it, even if it were tens of thousands of dollars. But a lot of people can't. So they kind of have to pay that high premium to private insurance companies. And you know, it's a gamble. It's a roll of the dice.
And then Medicare Advantage is basically Medicare, except you're buying it through a private insurance company. And when you buy it through a private insurance company, it's just like when you weren't a senior, you have to use their network, which means you have in-network and out-network. So as you mentioned, if you live, let's say in Charlotte or Dallas, Texas, your in-network may be quite a few doctors. But if you live in Monroe or Lincolnton or the country or a Trump country, I would say that your network may be limited because there may not be that many doctors. So you actually would have to go out of network, which costs you more. And so that's kind of, is that kind of what I'm hearing?
That's absolutely, that's exactly the deal. Yeah.
Okay. And so,
So like my buddy out here, says, well, yeah, all my doctors are in network and I've checked and all that kind of stuff. Well, that's today, you know, and once he comes down with some sort of rare leukemia or something, well, you know, it's a gamble. But would you rather gamble with the government's operation, basic Medicare, where you have access to every physician and hospital in the country, or maybe get a gym membership in exchange for giving away that option with traditional Medicare? I mean, with Medicare Advantage.
Well, it really comes off almost like a again, you know, we talked about the state fairs earlier. I feel like the Medicare Advantage pitch sounds almost like something you would hear at a carnival, like, oh, if you buy 5 darts, we'll give you 2 free. But that's not all. We've got guns that look like knives and knives that look like guns, and it just feels so. And I love the hustle from the fact that, you know, I've been in marketing sales for so long. But obviously,
but wait,
case,
we'll throw something else in.
More. We'll give you 2 nights free stay at the Trump Hotel.
It is a hustle.
It is a hustle. It when something comes off that salesy, when it's something that's that important, you got to wonder why we keep doing something that is so, I don't know any other way of saying it, but just so stupid. Because you can see, I read through articles before I came onto this show this morning to kind of get an idea of what the media has said and uncovered about Medicare Advantage. And they were calling it a scam years ago, like in 2010, 2014. This has been a long, I didn't realize the debate had gone back this far. There was not really any positive articles about Medicare Advantage at all. except for the ones written by the companies themselves,
Yeah.
you know, as a PR piece.
I think AARP sells medical advantage plans, right?
They do.
And so, you know, I
The
mean, I
United
don't know
Health.
the official AARP for position, but yeah, I would think so. No, it's very discouraging. But yeah, the power of marketing. Can we mention now or at some point that there's going to be a presentation?
I'm sorry. Yes, go ahead, Dr.
Go ahead.
Yes, please.
Well, the organization of which I'm a member, the National Organization's Physicians for a National Healthcare Program, is sponsoring a webinar a week from tomorrow. And I think Chris is going to provide the link to it where you can kind of register, and it'll also be on the Facebook page. And the title is The Disadvantages of Medicare Advantage, right? And one of the speakers is actually one of the founders of our organization. And she has written dozens of academic articles about these details that we've been discussing. And so I think I hope it'll be an excellent, clear presentation on the facts of Medicare Advantage. She and a couple of other folks who are really national experts on this. Actually, I think the group presenting this is the North Carolina Medicare for All Coalition. I'm involved with so many different groups and webinars, it's hard to keep them straight. But the North Carolina Medicare for All Coalition is sponsoring this webinar, and obviously it's free, and encourage people to kind of tune in to learn more about this scandal, this con.
Thank you, Dr. B. And sorry to interrupt you, Jenny, but I'm actually posting that right now on our page. So that is being posted right now on our Facebook page. So if you wanted more information about that, you can RSVP and get information about that on our page. So.
And it's great to get informed on stuff like this. I mean, you know, I've gotten an education today and just having these important topics because, you know, people ask me all the time, how do you get involved with advocacy and activism and all that? And so a lot of times do something that's near and dear to your heart. Like if you are somebody that is in that age bracket that that uses Medicare or end user, or you have a loved one that is, it's a great way to talk about this and talk about the need, not only for our seasoned citizens, but also, quite frankly, it dovetails into reason why we need Medicare for all and universal health care, and why so many high wealth nations similar to us all have it and we don't for some reason. How we basically came to the junior high dance and just refused to dance, and we have, what is it, 50-60 million people now because of the pandemic that don't have health coverage. It's unfortunate that we can afford nuclear weapons and all jet fighters that fly so fast they black out the pilots, but we can't wrap our head around the decency of making sure everybody has access to health care. And can afford it. The other thing is, I saw a stat the other day, the average hospital stay for like a 3-week stay for COVID, for example, is right around that $200,000, $250,000 mark. And even if we found some kind of accounting way of cutting that in half, it's still $125,000.
Yeah.
Any way you slice it, modern healthcare is expensive because of the technology, the training, the medical personnel that goes through in some cases decades of schools, and all that. That's expensive.
But Jenny, my question I have, because I've heard Dr. B on this show, and I've seen a couple of some of their groups like videos. Is it really that expensive? Because they do almost the same thing in Israel, and with the same technology, the same like modern stuff that we buy from whoever, and they do it for like fraction. It seems like, and so I don't know if this we've been sold that it is expensive. Modern technology is expensive because that's what we're used to. So I guess I don't know, Doc. I mean, is it really that expensive? I just
one of the first things that I started really trying to understand when I got involved in this Medicare for All advocacy 4 or 5 years ago was a documentary about the healthcare situation called Fix It, Healthcare at the Tipping Point. And if any of you are interested, you can watch it live online. Just go to YouTube and Fix It, Healthcare at the Tipping Point. And so one of the country's greatest experts in healthcare costs is named Don Berwick. and he used to run the Medicare agency under Obama for a while. And so they asked him about exactly that. Why are prices so high? And he said, I'll wager that there's not a hospital executive in the country that can really tell you how much a particular service actually costs him to do, whether it's an appendectomy or a labor and delivery or an MRI scan or a blood test. He said, they don't know. They just kind of make up these figures about how much it costs in order to cover their entire overall operating costs. It's just smoke and mirrors. So obviously all these things about our costs are crazy, and they don't have to be that expensive. In that documentary and other places, there's all sorts of studies about how in any given city, where it's Charlotte, Houston, New York, you go to 5 different hospitals and ask them, what do you charge for a broken hip operation? And the cost might go from $10,000 to $100,000. I mean, that's absurd. And it just speaks to the fact that the free market that people keep mythically talking about in American healthcare is non-existent. It's all smoke and mirrors.
Well, and again, I think this is why we shouldn't have privatized in any shape or form Medicare, because when you have companies involved that to exist, they have to turn a profit. That's completely understandable. I totally get that point. But they're dancing on our dime. That's the thing is we're paying into that system that supports Medicare, and then they're going in and also turning a profit off it. So they're literally double dipping the system when we should have just cut to the chase, cut them out of the deal, make it more efficient. And then if we want to address medical costs and all that, then we just do a consistent audit of the deal and find out why our supply chain is so high and compare it to Canada and Israel and all these other countries, which is valid, because I know as a trans woman, for example, Canada, their medical system, their medical insurance covers all the trans related surgeries and treatments, but they fly their trans people all the way to Thailand. Usually spend 4 to 6 to 8 weeks there, get all the surgeries they need. They pay for a liaison with them. They put them up in a medical hotel. They pay for all of that. And because Thailand, gender reassignment surgery is about $3,500, maybe $4,000 over there. Here it's about almost $30,000. And the surgeons over there are just as good. The hospitals are just as good. They have just as high of a success rate, if not better, than the American surgeons. So you're talking about 90% off.
Well, they can't be that good if they're not American.
Yeah, of course not. There's no good surgeons that live outside of the United States.
Dr. B looked like he wanted to say something.
Yeah, I think I forgot.
Oh, that's okay. So this is when y'all were talking, I was thinking about this. Do y'all remember during the Obamacare Affordable Care Act thing, and when he made the mistake of saying you will always be able to go see your own doctor, and then they nailed him on it when it turns out that some of this,
I think what he actually said, you can keep your insurance plan.
Yes.
That was a big thing. You can keep your insurance plan. And then everybody railed on him for that. And what was totally lost in that discussion is the insurance plans that people couldn't keep were these complete ripoffs. Some of these like cancer policies and plans that had all these exclusions and whatnot. So basically Obama did them a big favor by saying, you're getting screwed. We're going to ban these. Those are, you said I could keep my plan. So it's just ludicrous. The point I was that I'd forgotten when Jenny was talking was when you think, anybody who's listening, of hospice, what's the first thing you think of? And the first thing is you're dying, right? And so they're going to kind of make the passage to death a little easier for you and your family. They're going to help you die. What's the last thing you think of with hospice? How about for profit? There are I think they said that 80% of hospice programs in the country now are for profit. So in other words, people are making money off of you going through the dying process. Nobody has any qualm with people making money off you dying, like morticians and funeral homes. That's great. But good Lord, to ease your suffering and you're making profit. So that's another issue of kind of how capitalism has maybe gone a little bit too far in the healthcare industry.
Well, and I think anytime that you get into essential services or what I call utility services, that our government has took on or has been compelled because society needs that to keep our society together. We look at the vaccines, for example. The vaccines are all paid for everybody. They were pre-negotiated price. They kept it at $28 of an inoculation, which is a very fair price. There's not a lot of money in vaccines, just because it's more of a public service rather than a profit center. And it was an example of how the government and these private companies work together for the common good. And I do believe that, but we need more of that. We need more what I call common sense stuff, where we go, how do we give the best value and still create safety for the end user? Because our government shouldn't be ripping us off, and they shouldn't be involved.
It's hard to
in
discuss
schemes.
common sense when there's somebody over there stuffing money in people's pocket.
Yeah,
not to talk about that.
Well, and they make it seem uncommon. They make it sound like, oh, well, the liberals are just trying to spend your money. And I'm going, well, if you're having to pay for on top of Medicare, you're having to pay for all these plans, then that's a problem.
Well, Hey, Jen, that's why I didn't really understand when I was watching these commercials, and I know it was originally a joke when I was watching these commercials, but now as I really read into them, the same people that were saying, oh, I couldn't see my own doctor, with Medicare Advantage, you may not be able to see your own doctor because they're not in the network. So you would think if you were against it with Obamacare, Affordable Care Act, you'd be against the Medicare Advantage. But also when you watch these commercials, they're getting more over the top, almost like those sham wow commercials, where you say, and you get this, and watch the commercials. They are so over the top that they're almost a joke, like a Saturday Night Live skit. And so I'm wondering if now they're getting so over the top that people are going to go, this is something, like you said, so if it's too good to be true, it must. And he's like, and you get this. I can't believe you. And it's like,
we all get junk emails, right?
Yes.
And so for a while we were all getting these things from a prince in Nigeria who wanted to give us $20 million. And we all noticed that these things had bad grammar and misspellings in them. And we're all thinking, they didn't fool me, because I know that I heard and came to understand that these commercials that go over the top like that, just like these scam emails, are deliberately aimed at people who probably aren't that sophisticated about detecting scams from real life. And so kind of the more outrageous they get, they are self-selecting their audience of people who are inclined to say, you mean I get a can opener for Medicare Advantage? Wow, you sold me, buddy. Well, that's not going to work on you and me. But evidently in these audiences that watch the kind of TV things you do, Christian, other than yourself, that they're more susceptible to this. And so I think it's very deliberate and very calculated, all focus groups with all this marketing stuff, very targeted at people who are more likely to fall for these over the top kind of pitches, just like the people that did for these used car salesmen and these other kind of ads that the Ron Popeil kind of things.
And truthfully, I always think back when I think about my marketing career, my sales career, and I think about this one person that he ran a sales organization that sold investment land in Missouri, and if this piece of land, this lot by the lake was $100,000, for example, of prime real estate. He said you had to have a $200,000 pitch to sell a $100,000 piece of land. And so in marketing, and these companies know that, they need to make it look so value added and so appetizing that you're selling the sizzle and the steak, but you really end up just getting the sizzle or get sizzled. And then anytime, and because I've been involved with so many things in the marketing world, when I see some overselling or over pitching or over promising, like these Medicare Advantage, like I read through some of the ads too, and they were just like, wow, consider me sold. It seems weird because one, Medicare itself is a government program, but I'm like, why do we have to hard sell Medicare Advantage? What is the downside of this if we have to hard sell it so much and throw so many innocuous like gym memberships and toaster ovens and roadside assistance, whatever they come up with in their pitch? It just seems like a lot. And using celebrities to add credibility to their pitch means there was a good chance they don't have credibility, because you don't see Medicare, you don't see the actual government part of this. You on Medicare or Social Security, like, ooh, make sure you get your Social Security, and use a celebrity to pitch that.
Hey, Jenny, we need to wrap up here. Let's go around the Brady Bunch screen and tell us. Thank you so much, Dr. B. This has been very informative. I hope if you're watching this show, if you watch it later, and you have, like I do, a senior in your family who is on Medicare Advantage, take a look at it. Take a look at maybe what it has to offer, what the advantages are to moving back to Medicare as open enrollment starts and then ends in December. Two things that we weren't able to touch and that it probably wasn't appropriate for the show, but I just want to let people know that I actually in Charlotte, and I think, I don't know if Dr. B does, but I know Jenny may as well. I live in the 9th Congressional District in Charlotte currently in North Carolina. Our congressperson is Dan Bishop. Dan Bishop has been an anti-vaxxer, anti-masker, pro-Trump person since he was elected. And there was an article that came out that said that the 9th Congressional District may be one of the, may have some of the highest death rates of COVID-19, specifically in Robeson County, which is Robeson County, if you know, in North Carolina, is a large Lumbee tribe, Native American tribe, and they have very, very high death rates and rates. And so it is very sad to know that our 9th Congressional District, of all the congressional districts around the country, may be some of the worst hit areas. Not only that, but the Lumbee tribe, and they overwhelmingly voted for Dan Bishop. And I hope that they take seriously what he has not done for them. But also I do want to congratulate and applaud a city council person in our home city, or my home city, and I think everyone else, Charlotte, North Carolina, Braxton Winston. Last night, or Monday night, he actually championed trying to stop a funding of $120,000 to a company that hired prisoners in Florida. And he spoke very passionately about the city should not be spending money on companies that use prison labor, cheap prison labor. And there was some back and forth, and it ended up a 4-4 tie. And the mayor, unfortunately, our mayor, voted to give the contract. And so, and then she made the statement, maybe you should use other avenues to fight prison reform. This is exactly how you stop these things. And so I do want to congratulate Braxton Winston, because this is something that not many people even knew was going on, or it was a Monday night meeting. And I thank Braxton Winston and the other people. Dimple Ajmer, I believe, voted with Braxton, and Matt Newton, and I think there were 4 people. So thank you very much. So let's go around the Brady Bunch screen and tell us where you're going to be in 30 seconds or less. Who wants to start? I guess Jenny, and then Dr. B, and I'll end.
I will be this Saturday. I will be at the Women's March, the Solidarity March, and it's on the National Organization for Women, Charlotte's Facebook page. So if you do want to attend, of course, it's free. It's going to be outdoors. Masks are required. There will be, it'll probably go on for about an hour and a half tops, but it will be outside. It will be very responsible. Dr. Gina is the one that's headed this up and has done a great job of organizing, and so has a lot of other organizations as well. We've all pitched in to try to affect change. And thank you, Braxton, for standing up for prison reform. It's one of the many things we need to do in this country, and it's unfortunate that, again, private prisons are hiring basically slave labor for about $1.50 an hour. Exactly. And they're also competing against small businesses in their local area too.
That's right. That's right. Dr. B?
Yeah, I'm going to be still hanging around here in Western Colorado watching the aspen turn over the next couple of weeks, which is always very dramatic. I'm going to be getting over the worst cold that any person has ever had, but I was COVID negative because it really scared me that I might have gotten a breakthrough case. And I'm also going to continue my new job. I'm doing some part-time volunteering in a middle school cafeteria because they have a vast shortage of school employees out here. Everybody says if you have a commercial bus driver's license, you could be a hero probably to any school district because of so many shortages in the school. So I've been just kind of helping out a little bit there.
Well, thank you so much, Dr. B. And as Jenny mentioned, she reminded me to let you know that October topics are out. The first show we will have is next week, October the 6th. The topic will be, will post-COVID-19 equal the Roaring 20s? We will have here the Deputy Director for the Small Business Association, United States Small SBA. He will be on with us, plus our own Manolo, small business hero, will be on the show as well, talking to us about how he survived COVID, but what is in the toolbox of the SBA to help you come out of COVID. If you're a small business owner, please watch that one. The next week, I think it's going to be an interesting show. It's going to be 2 days after Columbus Day, and the topic is, was Columbus a hero or villain? And then the week after, we will be talking about, has the real South risen and won the culture war already? That's an interesting topic. And then the last show of the month in October, the topic is, what's an advocate versus an activist? We will kind of talk about those kind of things as well. So anything else that I missed, Jenny? Thank you for keeping me on cue today.
It's kind of like herding cats. It's just like we just move the show along as best we can.
That's right. So, you know, yeah, go ahead.
I think we're all good. I appreciate everybody for watching week in, week out. Thank you, Dr. B, for being on and explaining and advocating and educating people on the disadvantage or Medicare disadvantage program, and maybe why we should rethink what we're doing.
Exactly. If you're on Zoom, stay on so we can do a brief promo, and otherwise we will say goodbye with this wonderful music. If you can. Bye, y'all. See you next week.